our Health Happen show. We do it every Tuesday here at 11 o'clock. And today is kind of special because today is Colorado Gives Day. So nonprofits from around the state are asking for your donations, and we're one of them. We're 9Health. Maybe you think we're part of 9 News. In actuality, we're our own nonprofit, and so we're here to tell you about that today. And we have some special guests. We have our CEO and president, Gary Drew. Say hi.
Hi.
And we have our our vice president of philanthropy, Melanie. So thank you.
Hi, everyone.
Melanie Zeitler for joining us. And you know, the reason we're doing this today is really to share with you a little bit about 9Health and kind of the difference we make. We tell you every week about the health things and the prevention that you should be paying attention to, and really giving you that unbiased education and news that you need to make good health decisions. So today we're going to tell you how we make it all happen, and that's important too. So we have donuts here. Gary, why do we have donuts? We rarely would have a donut at the health fair.
This
is
never
so
have donuts
incongruent.
at 9Health. I just want to say, but you know, as inspiration, we'd like you to show us the dough. Sorry, it's from a movie.
That was a dad joke.
That was a dad joke. Yeah, to compensate for it, we wanted to show you the fruits of our labor. Okay, there's fruit back here too.
Okay,
all
very
right,
good.
Enough silliness.
Well done, well done. We had to add a little levity to it, but in all seriousness, today is Colorado Gives Day, and it's an opportunity to donate to your favorite nonprofit, and we're hoping to share a little bit with you about there you go, why 9Health would be worthy of your donation. So Gary, I'm going to turn to you. You're the president and CEO. Tell us kind of what is it that 9Health is doing in the community every day to help people, and why that's worthy of people's donation.
You bet. So one thing I didn't really understand years ago when I moved to Colorado, I had heard about 9Health Fair, and I too had thought it was part of 9 News.
Mm-hmm.
It did generate from 9 News 40 years ago. This is our anniversary. Happy
That's right.
40th. And so what's great about this organization is that it's run in every community around the state. 125 health fairs are run entirely by volunteers. So 10,000 of you come together and put on a health fair wherever your community wants it. And the value of that event is just priceless to the people that come. I've gone to probably 60 health fairs now over the last couple years, and I can tell you I feel so good after I go to one. Not just for the people that are learning about their health, and we're going to tell you a couple of the stories which are really powerful. But as importantly, health happens every day, every moment.
Ooh, hence the name of our show.
Health happens every day, every moment. And our mission is to help you think about preventive health more often, do one thing better every day, even if it's a little scary, like changing your diet or whatever. We can help nudge you along with that. And so we're transitioning as an organization from not just running health fairs and helping communities run these fairs, but also being there with the education and with the access to actual care that you might need that helps you become more preventive minded. So it's a theoretical discussion in that way, but really what we're doing through this show every week is helping people learn the language of health. The language of health is new to all of us.
That's right, and it's so important.
Isn't it?
I mean, we don't understand the simple things. I mean, like what is a co-pay or deductible or co-insurance. I mean, these things it is confusing. Even people who know a lot about it are confused about it. So this brings up a good point, though. Doing all these new things does require some investment.
It does.
And so that's a little bit why, maybe Melanie, we can turn to you and share with us why Colorado Gives Day is an important day for us.
Absolutely. Well, around the state, Colorado Gives Day is 24 hours of giving, and there is an incentive fund through Community First Foundation and First Bank. It was set up 10 years ago by the foundation. This year, it's a $1.5 million incentive fund, so if people donate today, on this day, December 12th, up till midnight tonight, every nonprofit that is involved with Colorado Gives Day gets a percentage of those funds. So it's really a wonderful thing if you donate all throughout the year, right? But today especially, because there's added incentive through the generosity of Community First Foundation.
And look over your shoulder, we have this website.
Yes.
So is this where you would go?
Absolutely. So www.coloradogivesday.org /9Health Fair, and you will see us there, and you can read about the organization further and our profile and all of the reasons why it's really important to give today.
And what you're saying is that if you donate today at Colorado Gives Day, your donations could be increased by this fund.
Leveraged by the incentive
So
fund.
your donation goes further today.
Absolutely.
Yay, very good, very good. Okay, great. We promised we were going to tell why, who are the people that really benefit. And if you're watching this out there and you have questions like, why should I give, or what do we think that this money's going to do? So you have some of that information. So, if you're wondering, you can ask us. But I'll ask you.
All right.
Who are some of the people that really benefit from 9Health?
So in the past, it was people that have gone to a health fair. And over 2 million folks over the 40 years have gone to health fairs. Thousands upon thousands of them receive calls from 9Health after a health fair, alerting you to higher elevated stuff in your blood. I don't know what else to call it.
That's
It's just
highly technical
stuff.
term.
It's like cholesterol and sugar, things that may not belong there, and we let you know about it. So that's been our value in the past. Now what we really want to be able to do is connect with people every day of the year, like I was saying. So I would say that the folks that benefit from what we are doing are people that are learning this language of health every day, because it is mysterious and we don't know which doctor to go to and when you go to what for what. There are so many questions coming up now as us health consumers are evolving to have to pay for things ourselves directly. And so if we can help people learn how to do that wisely and save money and take the best care possible for your given situation, that's our mission. So we want to help people be health positive every day. So I would say, for me, my story is that basically a couple million people now have watched episodes of this program. And so those couple million folks are benefiting from what we're doing right now. Health fairs help fund it. You help fund everything else that's happening right now, such as health education.
Yeah, very good. Yeah, I don't think people really realize that. So that all the things that we do really are funded by the community, for the community, and the volunteers. So, are there people, Melanie, that you've met out there on in your travels that you've talked to that have really benefited from being able to take advantage of the services?
Absolutely. Everywhere from rural communities in eastern Colorado, Lyman, Bennett, Elizabeth, all the way to Metro. Recently I was at the Denver Indian Center Metro Fair, and there was a gentleman who looked as if he was a little confused as to where to go, helped guide him through the fair a bit, and then he ended up getting an instant A1C finger stick, which gives you a 3-month average of your blood sugar over time. Turns out, right in the moment, the man had a blood sugar of about 600 and was very close to going into diabetic coma. The physician on site at our Ask a Medical Question station took him right away, got him through making a phone call to a federally qualified health center nearby, and the man was then placed into treatment to help with his diabetes management. So here's an example of a man walking around with a very terrible chronic disease. Yeah, and didn't even know it. So, that just made my week that this man got the help he needed in the moment he needed it, and it was through 9Health Fair, and that's why we, need your contribution. So thank you to everyone in the community.
Okay, so if you have questions about what does 9Health Fair do and what can we help with, and 9Health, what does our future look like, you can ask us that question because you have the people here who can answer the questions, right? But Gary, I remember the first time I ever set foot into a health fair. A man came up to me, rushed up to me because I had a 9Health Fair name tag on, And he said, "You saved my life." And I looked at him, I'm like, "I just started working here, I didn't do anything." And he proceeded to tell me a story, and he said, I went to a health fair and I had a high PSA, and that's prostate-specific antigen, and it's, in mostly males, and so it's a precursor, or it can indicate prostate cancer. And so he said, I had really high one, I went to my doctor, and they did a surgery right away. And they told me that if I hadn't gone and gotten it treated right then, I wouldn't be here right now. And he had tears in his eyes, and I, of course, I have a strict rule, no one's allowed to cry by themselves, so then I had to cry. And then, it was like amazing to me, and that was the first time I ever set foot into a health fair. And so I mean, I hear stories like that all the time, and even when I'm not at a health fair, and I don't know if you've heard those kinds of really heartwarming, heart-wrenching stories in your travels. You've been all over the state.
I have heard a lot of these stories. Every fair I go to, I hear a story like that. Somebody's life has been saved. I was in Alamosa this year, in fact, at the health fair down there, and it's such a great place to visit. I love going there. And I met a couple that was standing in line to start talking to him, said, "Where are you from?" And I assumed they'd be from Alamosa or nearby, but no, they were from Albuquerque. They had driven all the way from Albuquerque to Alamosa to go to the health fair. And the reason why is that the husband had gone to a health fair years earlier in Buena Vista, and they discovered, again, something pretty serious for him. I'm not going to name the exact thing because it was a very long word, and it was a medical word. And they've been coming back ever since because of the value of what the health fair provides. And it's not just the cost. So, I mean, the model of a health fair is really unique. It takes a large volume of people to take advantage of a health fair, to be screened, in order for the organization to charge next to nothing for what it does. And in fact, we hardly ever talk about it, but most of what these health fairs provide are free screenings.
That's right.
And so blood screenings are part of that, of course, but your blood pressure, your eyesight, your dental, your balance, especially for older adults, all become really important and valuable, and they only happen because of the generosity of folks that give to this organization as a nonprofit. So I want to say thank you to everybody that does give, but I also want to say thank you to everybody that goes to a health fair, because that's what keeps the model going. It's what keeps it alive and in 125 communities every year.
Right. And we don't have a health fair right now that you can sign up for, but we will have that available for you 1st of February. And so health fairs happen in April and they happen in the fall. And so if you are looking online, you can go to 9healthfair.org and find a fair coming February for April. And really important, I love what you said about, it's everybody coming together to do these health fairs that actually help them stay effective for the community. So we need everyone to do that. And by the way, it's really great for your health.
Yes.
Yeah. So,
Yes.
Again, we're here just talking a little bit about Colorado Gives Day. There's a lot of nonprofits in Colorado. We're one of them. And Melanie, say just one more time about a little bit, why is it important today to make a donation if you're thinking about it?
Thanks, Marla. Again, through Community First Foundation and First Bank, there's a $1.5 million incentive fund to donate today. So all Colorado nonprofits participating in Colorado Gives Day will get a percentage of those funds. So thank you to all of you who have already donated generously to 9Health, and thank you to those of you who are planning on donating to 9Health. We have a $16,000 goal for our Colorado Gives Day. So thank you so much for helping us meet that.
Yes.
Okay, here's a donut. Yeah,
Show us the donut.
Thank you.
We don't often eat donuts here, but this is why it's a really special day. That's how you know it's a special day, because today is Colorado Gives Day.
I'm not even allowed to touch it.
And we all have donuts. Cheers.
What?
Cheers.
Cheers.
Cheers to Colorado Gives Day.